My name is Mašková and I'm a gynecologist from the Czech Republic. I would like to introduce a new device, JETT plasma for HER2, and I would like to show you how to use to reach the best effect as we can have. We have this model of organs, of gynecological organs, and the first I dry vagina with cotton swab. So dry it very clear to have a dry environment in vagina to reach the best contact with applicator. The better contact, better effect. For which indication to use JETT plasma for HER2. We can use it for incontinence, stress incontinence and urgent, overactive bladder, vaginal atrophy, vaginal dryness, and also we can use it for aesthetic reason when young ladies after delivery are not satisfied with too loose vagina. And in which indication use which applicator. We have two applicators, G30 and G-Wave. So the first, again, dry vagina to higher effect, and then which applicator. I always decide according anatomical status. When vagina is too wide and too open and lower wall of vagina is too loose, I use this applicator G30. It's much comfortable for performer, and very slow movement in vagina move with this one. And again, how long? When it's too loose, 10 minutes. When it's not too loose, 5-7 minutes is enough. When I want to treat incontinence, overactive bladder or stress incontinence, I use this applicator because this metal plate is bigger, so we have higher energy and higher effect. And then I concentrate on upper wall of vagina and again insert applicator and very slow movement. And this is not so comfortable for performer because we have one stripe to another and treat the whole shape of upper wall of vagina. And at the end I concentrate to this area, a urethra bladder junction, and zigzag move, very slow movement, again very slow movement in this region. How long this? But again, it depends on how heavy is problem, how difficult it is. You can treat from 15 to 20 minutes, average 17 minutes, 15-17 minutes, it's enough. And at the end of treatment, when its orificium is too wide, and also when a lady has aesthetical problem and she wants better anatomical status, this G-Wave you can treat the vestibulum, this movement, and from number 3 to 8, and very slow movement, and you after 3 sessions you can see how in introitus how its vestibulum is closer and closer. Usually I use to treat external part of the vagina, I use cream with hyaluronic acid to improve effect. And next treatment is vaginal dryness. Usually the ladies suffer from vaginal dryness, vaginal atrophy, as very narrow vagina. So to use G30 would be very uncomfortable, maybe painful for them. So I always use G-Wave. Again, sometimes I use, or mostly I use cream with hyaluronic acid. In this case, you don't need to dry vagina because vagina is too dry, therefore they have this problem. So you don't need to dry vagina, just put a little bit cream on applicator, and again very slow movement and one stripe to another in the whole shape of vagina. 10 minutes upper wall, 10 minutes lower wall of the vagina. And very important is to ask lady where she feels the biggest problem, when it's in vagina or outside. When she said it's just in vagina, you can treat vagina or maybe orificium 5 minutes around. When she said it's mostly outside on labium, then put cream on labium, and so again very slow movement outside. 5 minutes one side, 5 minutes the other side. Aesthetical question. Usually because the vagina is too loose, so use G30, it's more comfortable. 10 minutes upper wall, 10 minutes back wall, posterior wall, and again help to close introitus with G-Wave 5 minutes. How many sessions? Usually 3 sessions is enough, and 1 session in 1 week, so 3 sessions in every week. And how long it would be prolonged effect? I think when ladies are younger and we treat incontinence, the effect would be prolonged to 2-3 years. In vaginal atrophy, you inform your patient that it's hormonal status and age status, so you should repeat every year. But next year, the first session three times, and next in 1 year it would be enough, 1 session. It's my opinion. And you can also use this applicator, this pen with flat applicator, and then it's not seen here, but when you have very tough scar after episiotomy or after rupture on perineum, you can treat with this applicator. And again, 10 minutes and small circle movement on scar. On perineum, you have to use gel. Put cream with hyaluronic acid, but you have to put quite high layer of indifferent gel, ultrasound gel, because on perineum, on skin, it could be painful. So don't use intensity 8. Usually intensity 6 is enough for treat skin scar, and it's not so painful for patients. Device you can use to treat incontinence, stress and overactive bladder, and the better effect is to overactive bladder. The results are much better. Most patients refer 80-90% improvement. Stress incontinence 50-80%. So it helps most of patients, but to overactive bladder is much better to use it. And another problem when you can use this jet plasma is to treat scars. Scars after vaginal delivery, when after episiotomy or after rupture you have that scar very tough and it's painful for ladies, and they can't have intercourse. So this device can help to smoother scars. And again, you have to know where is problem, to talk with the patient, ask them what she feels, what is her problem, and then to palpate, to touch where is the scar, where is the tough tissue, and then put cream with hyaluronic acid, G-wave, and concentrate just on this scar, just to tough tissue, and 20 minutes treat just this area. After one session, the lady will feel relief, and scar will be much smoother, and after the third or fourth session she will have normal intercourse. To treat or to cure tough scars, especially in vagina, it's 3 sessions is not too enough, mostly 4, sometimes 5, depends on how tough it is and how large it is. When it's through the whole vagina, you have to take time and treat it and repeat 4 or 5 times. So insert applicator and very slow movement to fornix and back. Very slow movement, and to orificium and then back. And with applicator G-wave, again insert applicator and very slow movement to cul-de-sac and back. And with this applicator you have to do stripes, one stripe to another, according to metallic plate on applicator. And one side, back, and the whole surface of upper wall of the vagina. And then you have to, at the end, you have to concentrate on this area, on urethra bladder junction, and just small movement, zigzag on this area to improve stress incontinence or urgent incontinence, to put the most energy to this area. How to use applicator not to be painful for patient. This treatment is totally painless for patient, but to move with applicator in vagina would be a little bit uncomfortable for them. So put just small drop of indifferent gel, ultrasound gel for example, on the top of applicator G-wave or applicator G30. Then just to smoother insertion in vagina, but don't put too much gel on this metallic plate, this. Just small drop on the top, and then the insert applicator and then press pedal. Don't do opposite, not press pedal, insert. The first insert applicator, then press pedal, because when you press pedal and insert applicator, your patient would feel pain stick, like very painful needle. So don't press pedal, the first insert applicator, then press pedal. And to treat and which intensity? Always the highest intensity as you can. So for vaginal treatment, always intensity 8. On external treatment, in internal ward about around hymen, you can use intensity aid, or you have to agree or to talk with patient what is comfortable for her. If it's too painful, lower intensity. But in orificium, it's very perfect to use intensity 8. Outside, usually 7, 6. But again, you have to talk with patient what is careable, what is it's enough for her to bear it. Pain, or because it's not pain, it's like very uncomfortable heating, or like very sharp needle in contact.